It's October 8th, 2021. I was looking up this disease, which is parasitic infection, because I watched a video about a lady who was having abdominal pain, and it ended up that she was diagnosed with this after quite a long process with different doctors. So, this article. This is who wrote the article, and it's in this um, journal, and the link is up here. But if you're going to cite it, you need information on the date when it was written, which is all up here. So I was looking at the article I was reading, and lots of times, just like on YouTube, there's different things that show up that relate to what you're looking at for on the side over here. And I found this article, Ivermectin as a potential drug for treatment of COVID. So I decided to click on it, and here's an article that is in this journal from January 3rd, 2021. This is the number. The DOI is the link to look it up on anywhere. You can take this link and put it into your spot up here, and it will lead you to it. And here are all the authors of this article, Ivermectin as a potential drug for treatment of COVID-19, an in-sync review with clinical and computational attributes. So when you're looking at an article, you want it to have credit. You want it to be something that's going to tell you the truth as far as they know. So this is letting me know I can click on here and find out all the author's information. Let me show you. Department of Pharmacology is telling me about where they're coming from in India. And I believe it's just one of these for the moment. Okay, so anyway, the article, lots of times when you're looking up stuff, they will only have the abstract, but this has a lot that's done in the review. They have the abstract talking about COVID cases are on the surge. However, there is no efficient treatment or vaccine that can be used for its management. This was written in January 3rd, 2021, which even though they had the vaccines at that point, it's likely that it was worked on way ahead of time and turned in, and then it had to get reviewed. Numerous clinical trials are being reviewed for use of different drugs, biologics, and vaccines in COVID-19. A much empirical approach will be to repurpose existing drugs for which pharmacokinetic and safety data are available. That means that drugs that have already been checked and tested for safety, if they can use them for more than what they were originally set for, then they already have all this safety data available, and so that will take a lot less time to investigate the drug, because this will facilitate the process of drug development. The article discusses the evidence available for the use of ivermectin, an anti-parasitic drug with antiviral properties in COVID-19. So they're talking about they're telling you that in this article, they're going to show you that the anti-parasitic drug what they found as far as it having antiviral properties for COVID-19. And then they tell you the method that they used it, carried out using their clinically significant attributes. A more thorough understanding was met by virtual embodiment of the drug structure and realizable viral targets using artificial intelligence-based and molecular dynamics simulation-based study. I didn't know they were using AI to study things like this. Conclusion, certain studies have highlighted the significance of ivermectin in COVID-19. However, it requires evidences from more randomized controlled trials and dose-response studies to support its use. So they're saying that they've done studies and they want more studies done. Introduction basically tells you what this article is going to be about. Numerous clinical trials are being reviewed for the use of multiple drugs, biologics, and vaccines in COVID-19. Ivermectin is one of the potential drugs that can be repurposed for its use against SARS vaccine. Now, I want to tell you that a lot of people are like, oh, ivermectin is a horse anti-parasitic, and people shouldn't be taking it. But in this study, they're talking about repurposing, and that's where I think a lot of people get confused, because this is actually done with a lot of medications. As of 6/10/20, 38 ivermectin trials are registered with clinicaltrials.gov and 8 with clinical trials registry in India to validate its use in treatment of COVID-19. So here are some details of the studies, and I'll have the link for this article below. So here's the letting you know different places: Pakistan, Egypt, Brazil, Colombia, Brazil, India, Egypt, Brazil. They're using it with different things. Like here, they're using it with cumin, zinc. Here, they're using it with azithromycin. Try to make combinations of something that will work. Okay, so here's that list. I just want to get down to the bottom here more. They're telling you what it is. It belongs to a class of ivermectins consisting of 16-membered macrolytic lactone compounds. Now, some of this can get really confusing for some people that aren't used to this type of language. Don't let it bother you. We'll get down to the conclusion in a few minutes. We're talking about in 1967 when it was first approved. It was discovered in 1967. First approval was in 1987 for treatment of river blindness. Okay, and that worked really well for that. They talk about how it works here. Evidence for use of ivermectin in COVID-19. In vitro, that means where they have a plate and they're putting the virus on it and then putting this, whatever it is that they're going to try to kill it into the plate, and then seeing what kind of results they get. Excuse me. So here they're talking about what binds to the protein in the COVID, what they found, and like here, 173 patients who received treatment with ivermectin, at least one dose of 200 micrograms per kilogram orally, along with usual clinical care, and 107 who received usual care, found out that the treatment with ivermectin was related to lower mortality, particularly in patients needing higher inspired oxygen or ventilator support. Another study by this group reported that ivermectin and doxycycline's combination was very efficacious in SARS-CoV-2 clearance in patients with mild to moderate disease. And then they go on to talk about how it worked or didn't work, what it worked better with, what different things were combined, what they found. And here they talk about the outcome. So they're talking about the outcome of the intervention. Overall mortality was reduced 15%. Outcome of the control, overall mortality reduced minus 25%. Adverse event in intervention, and here you don't see any adverse events. Anorexia and diarrhea, skin rash, when they used it with hydrochloroquine. Here, some were sleepy, some were nauseous, some had dizziness. On the intelligence-based study, this is really interesting. The drug-target interaction may be predicted by artificial intelligence using deep learning methods. This has been done by Deep Purpose, a deep learning framework for drug discovery. The drugs, as well as the protein targets, have to be encoded to formats appropriate for the model creation, and then we talk about how to do that. Molecular dynamic simulations-based studies. It's another different kind of study where they're trying to see what works. Here's the graph of different things that worked with it. Here's another diagram. And here's some more. You can just click on this and it'll show it to you bigger, and you can see the interactions. 3D representation of ivermectin showing interaction points. So it shows what it gets to. Discussion. These are always an interesting point of the articles. From the evidence that is available in our artificial intelligence and molecular dynamics simulations-based studies, ivermectin can be thought of as a potential drug for the treatment of COVID-19. Beneficial results have been observed with ivermectin in clinical studies. However, great diligence and regulatory review is required for testing of ivermectin in severe COVID-19 because of various reasons. So they're talking about when somebody has reached the point of where the COVID has attacked them worse than a mild case or right in the beginning. As ivermectin targets the invertebrates. So this tells you how it works inside. It's very detailed and really cool. And what I'd like to do is, if there's a word I don't understand, I like to just simply like go like this, and then I'll right click on it, search Google for what that means, and then it'll tell me. Okay, so that's what I do with a lot of stuff, and that's how I find out information kind of quickly. So then I like to go down to the conclusion. Hence, keeping in view the available evidence from clinical studies, ivermectin can be a potential drug as it reduced mortality and improved symptoms of patients with COVID-19. Moreover, ivermectin in combination with doxycycline seems effective, but they're saying that they need more studies to justify its use. Future recommendations. Ivermectin has been reported to show potent efficacy as an antiviral. So this is the repurposed diagnosis, antiviral, rather than just being an antiparasitic. However, its application is limited because of pharmacokinetic difficulties such as low solubility. These difficulties can be overcome by formulating liposomal ivermectin or other ivermectin formulations with improved properties. So there's a way to make the ivermectin so your body can use it better to attack the COVID. Furthermore, inhalation therapy of ivermectin can deliver high drug concentration to the lungs and airways to reduce the viral loads in such areas, or else it can be used in combination with other agents that differ in mechanism of action. So that's how you do a research paper, and here's all the references that they used for their study. So you click on that, it tells you basically what's down here. So when you're doing the research paper that you're going to be writing for school, or for anything, make sure that you know how you're writing it out. Are you doing it in, there's different formats such as APA or Chicago style, that you have all the authors and you have the dates and you have where it's coming from. This has copyright and license information right here. You have to give credit to everybody, and if you write a paper, do not do any plagiarism. Paraphrase what you're writing, and if you want to relate something to the article, make sure that you credit it every time. So the links for all this will be below, and I'm grateful for you, and I am here at your service.